Good evening, everyone. A warm welcome. I know we have had a long vacation of 2 weeks, and now I am sure all of you are back to learning. So now with this session, see, we generally come across this problem of how to treat pregnant women, right? So I think we have some answer to this, especially for diabetes in pregnant women, which is called as gestational diabetes, which generally occurs in 24th week of pregnancy, or sometimes now it is so unimaginable when it is occurring. So instead, and during this period of time, it is not possible to give any treatments. So through our Acharya ji Ramchandran sir today, let us learn how neurotherapy will be helping us in clearing away this gestational diabetes in pregnant women, which is very important because if that is left uncured, it might be affecting the baby also, the infant inside the body. So it should be addressed. And this is one of the ways which can be successfully addressed because this will clear it from the root cause. And neurotherapy, we have always learned that it will be curing our problems, whatever it might be, from the root cause. So today, we will be learning about this particular gestational diabetes from our Acharya Ji Ramchandran sir. And we all know that neurotherapy is from our Dr. Lajpat Rai Mehraji, who is the pioneer of neurotherapy. It's a non-medical healing technique that focuses only on treatment of ailments by stimulating specific points in the body. So this method is rooted in the belief that the navel is the epicenter of the body and disturbances in its position can lead to various health issues. So always our stomach is the basis. So let us keep it calm, and especially during this session, unless you are calm, peaceful, with your notebook, pen, everything ready, you won't be able to listen it carefully. So please put all things aside, come to this class and enjoy this session of learning of through neurotherapy on how to treat gestational diabetes. So with all our hearts, let us give a warm welcome to Acharya Ji Ramchandran sir. Good evening, sir. A warm welcome to you for this session. And we are all eager to learn about this gestational diabetes and how whatever ways we can treat through neurotherapy, because in general, alternative therapy, we don't have this treatment for especially pregnant women. It is like avoided. Any treatment is avoided for pregnant women. So we are looking forward to see how neurotherapy would be helping us and how you would be guiding us for this session. So a warm welcome from all of us. Good evening, sir. Please take over the session. Thank you so much.
Thank you. At the outset, I thank Joshi's Kerala group, Joshi sir and Anusha madam and all the team members for their yeoman service to society by hosting several platforms for different types of holistic healing techniques. And of course, for giving me a chance to talk about neurotherapy. Now, sorry. Now, here you are seeing our founder of neurotherapy, Dr. Lajpat Rai Mehra. He dedicated his life in the service of mankind through his unique medicineless therapy, and he founded this alternative method, non-medical method, in the year 1943, and later on it was named as neurotherapy, or Dr. Lajpat Rai Mehra's neurotherapy nowadays. Okay, so now today's topic, very, very interesting and very useful topic, gestational diabetes. Of course, it is said to be a temporary condition, but it has lifelong implications, as we will see. And we will go in slow but steady detail about various aspects of the therapy, various aspects of the disease. And later on, we will see how the therapy can be, what we can do through neurotherapy, and what are the help we can do for such ladies. So I hope if anybody of you are having people of this type, you are having friends, relatives who are in the period of gestation, whether they have gestational diabetes or not, it will not be immediately known. So anybody who is in their first, second, third month of pregnancy, those people, they will benefit by this lecture. And if this lecture will be for 2 days, today and the next week, next Friday. So in 2 days, I'll cover the entire thing. Okay, because you see, a lot of technical details have to be said. So I'll be giving those technical details which are very essential to understand the nature of this ailment. It's not even an ailment, but it's a condition which happens. Okay, so today we are going to talk about gestational diabetes mellitus, and it is commonly known as GDM, gestational diabetes mellitus. So this is the lecture schedule. We'll be talking about the introduction, the pathophysiology, risk factors, diagnosis, management and treatment, complications, both for the mother and the child, and then postpartum considerations, that is after delivery considerations, and there will be FAQs and discussions. So whatever we can cover today, we'll cover, and then the rest will be covered, completed in the next week. So I wish everybody should attend both these classes, because then you will get the maximum benefit. Okay, thank you very much. Let's proceed. So this gestational diabetes, it is a condition which affects around 7 to 10% of the pregnancies worldwide. And though it may last only during pregnancy, its implications can be long-term for both the mother and the baby, as we shall see. So how does it develop? Gestational diabetes mellitus, I am going to call it in short GDM. Only for 1 or 2 times I will call it by its long name. GDM develops when your body can't make enough insulin during pregnancy. And while it might seem temporary, it is like a warning sign for future diabetes risks. So in today's lecture, we will be exploring how it works, and then how we manage. In today's and next day's lecture, we will see how we will diagnose and manage it and what can be done to prevent it. So in these 2 lectures, we will be covering all these things. Okay, so pregnancy, as we all know, is a sensitive period that impacts both pregnant women and their unborn children's long-term health. And it is divided into three semesters, so 3 months. So the first trimester, each is called a trimester. Trimester means 3 months. So you have a first semester, you have a second semester, and you have a third semester. Because why these are given different names, they are different periods, because different types of developments and problems, etc., arise during these 3 months, during every 3 months. So the first trimester is the important phase, because the main organ of the fetus, main organs of the fetus, they are developed during this period of pregnancy, the first 3 months. So during pregnancy, the developing fetus is completely reliant on the maternal environment for nourishment. So by maternal environment, I mean the mother's internal organs, basically or fundamentally her digestive system, and then her other excretory system, everything. So for all this, the digestive system of the mother is most important for nourishment of the baby in the first 3 months. And when I say digestive system, many people, very pregnant ladies know that during this time, they are not wanting to eat many things, and they may have a craving for many things. So later we will see what cravings are good and what cravings are not good, and what we can do, why those cravings come, everything will happen. Everything will be told. At least by the end of next class, you will be having all this knowledge. Because today I will be concentrating more on certain aspects of the theory. Okay, so these during the placenta, during these hormonal changes during pregnancy, the placenta secretes hormones that make the cells less responsive to the effects of insulin. That's the real problem. The placenta secretes certain hormones, we'll see that also, and those hormones make the cells less responsive to the effects of insulin. Now, insulin has got a number of jobs, let us say. It is not only for controlling sugar, it has got many other jobs. So all those jobs will not be taking place properly because of the placental hormones. And that is known as GDM. When this happens, it is known as GDM. Okay. So then there is a word called overt diabetes. See, here you can see it is, I have written here, not overt diabetes. So we'll be talking about it also. Overt diabetes refers to pre-existing diabetes. That means it existed. A mild tendency for diabetes existed in the lady, but it is recognized first only during pregnancy. It was not recognized earlier, but it is not caused by pregnancy. It is a tendency which the body had, the lady had, but it is not caused by pregnancy or due to pregnancy. So, in other words, we can say it is a diabetes that meets the criteria for type 1 or type 2 diabetes, but it is only diagnosed for the first time when a woman becomes pregnant. So, next we come to the pathophysiology. So, what is gestational diabetes? Just as I said, gestational diabetes, GDM, is a diabetes that occurs in pregnant women. GDM is a condition in which a hormone made by the placenta prevents the body from using insulin effectively, and that hormone is called HPL, placental hormone, human placental lactogen. It is produced by the placenta during pregnancy and plays a key role in regulating the mother's metabolism and preparing her for breastfeeding. So it is actually a hormone which is good for the body because it is preparing the mother for breastfeeding. But in the process, in some women, it interferes with the insulin action. Not in all. That is the good point about it, that it's not all. And how we can counteract it, we will see in the next class. Okay. So gestational diabetes occurs when your body can't make enough insulin during pregnancy, because the hormone which is made by the placenta, it prevents the body from using insulin effectively. And as a process, what happens? Glucose builds up in the blood instead of being absorbed by the cells. Normally, for glucose to be absorbed by the cells, you require insulin. But this insulin, in GDM, the body cannot make enough insulin during pregnancy. And that is why it is happening. So it is usually diagnosed in the later stages of pregnancy only. That means in that 24 to 28 weeks, as Anusha madam said. So around that 24 to 28 weeks, it happens. And it often occurs in women who have no prior history of diabetes. So that means it happens so suddenly, and it is not due to pregnancy. It is because of some tendency in the body. Okay. And another thing, it usually begins in the 24th or 28th week of pregnancy, but it can happen earlier or later. Okay, it can happen either earlier or later than 24th week. So what is happening in the body? During pregnancy, the placenta produces hormones like HPL, human placental lactogen, and then estrogen. This is the female hormone, which is very useful, it's very essential for the ladies. And then cortisol. Cortisol is the anti-inflammatory hormone. That means it prevents body from having inflammation, and also it of course helps to increase the blood sugar level. Okay, these hormones are crucial for fetal development. But all these hormones together, what happens? They make the body more resistant to insulin. So normally the pancreas, the beta cell in the pancreas, it compensates by producing more insulin. But in some women, this compensation isn't enough. And this leads to higher blood glucose levels, and that is called gestational diabetes. So I'm just trying to make the whole thing understandable very in simple words. So I'm sure you'll be understanding. What is gestational diabetes? Is when the hormone produced by the body, they interfere with insulin action. Okay. Now, in the real kicker is that the glucose crosses the placenta, but insulin doesn't. That's the point. Glucose crosses the placenta, the fetal blood gets glucose, which is essential for it to grow. But insulin doesn't cross the placenta. So what happens? The fetal blood sugar goes up higher. And due to that, certain complications we will see. Okay. So now let us try to understand the difference between GDM and overt DM. So in GDM and overt DM, so you have got these 4 features. When does it develop? In GDM, it develops during pregnancy, usually 2nd or 3rd trimester. So 2nd trimester means from the 4th month, 3rd trimester means from the 6th month onwards. Okay, 6 to 9 is the 3rd trimester. Okay, and here overt diabetes in pregnancy existed before pregnancy, but it was undiagnosed. People did not know about it, and it was diagnosed only as after the pregnancy. Okay, severity. This has got a mild to moderate insulin resistance. This is only mild to moderate in gestational diabetes, but in overt diabetes, this is typically more severe hyperglycemia. That is same. More severe hyperglycemia means more severe diabetes. So that means overt diabetes, which is diagnosed later, it's a bit more severe than normal gestational diabetes. Okay. Then you have got diagnostic criteria. Here it is lower thresholds and it is GDM specific, but here it meets standard diabetes criteria. What these criteria also we will see later in the next few slides. Then postpartum status, it usually resolves. Postpartum means what? After delivery. After delivery, GDM usually resolves. But whereas if a person has got overt diabetes, it persists after pregnancy. And what are the complications we will see. Okay. So now difference between GDM and DM type 2. Here GDM, and this was overt diabetes, but here we are now talking of GDM and diabetes mellitus type 2. Now insulin is a hormone made by your pancreas that acts like a key to let blood sugar into the cells in your body for use as energy. So insulin is a key, understand. Without insulin, glucose cannot enter the cell. But if the body does not produce enough insulin, then also glucose cannot enter the cell. That's what is happening. Okay. When the insulin can't do its job, blood sugar levels can rise and cause symptoms of diabetes. So gestational diabetes is a condition that pregnant women develop when their body is not able to make and use insulin properly during pregnancy. So that's how it is. Then type 2 diabetes, when the body isn't able to use insulin properly, but here it cannot use insulin properly during pregnancy. That is the difference. Okay. So to put it simply, GDM is a type of insulin resistance which first occurs in the 2nd or 3rd trimester of pregnancy. GDM develops only during pregnancy due to hormonal changes that cause insulin resistance, and it usually resolves after childbirth. I again and again repeat this. It usually resolves after childbirth, GDM. Okay. Type 2 diabetes is a chronic condition. That is why overt diabetes is called type 2 diabetes, because it's a chronic condition that can happen anytime in life and usually requires long-term management. Women with GDM are at increased risk of developing type 2 diabetes later in life. Okay. Then what are the causes of gestational diabetes? Just 1 minute. I will just make this a bit more bigger. Okay. What are the causes of gestational diabetes? The exact cause is unknown. That is the real sad part. The exact cause is unknown. That means that is why it can happen to anybody. Gestational diabetes is thought to arise because the many changes, hormonal and otherwise, that occur in the body during pregnancy, it predisposes some women to become resistant to insulin. Means certain changes, the hormonal and otherwise changes in the body, they predispose, that means they cause some women to become resistant to insulin. And who are those women who are known to be at great risk? Those over 25 years of age. See, that is why in our earlier, let us say, generations, or rather century, in fact, a century back, women were married early and they had children early. That is also perhaps one of the reasons why this gestational diabetes was not known till recent years, because now the tendency is to marry after 25, 30, etc. Okay, so that may be one reason. Then those who are a non-white race, it is written here non-white race, but Indians, most Indians in the last century never heard of a term called gestational diabetes, and that is probably because they were marrying early, 25 years. Okay, then they are overweight. Of course, overweight people always have some problem or other, or they have a personal or family history of diabetes or GDM. Okay, that is why GDM may continue in generations. Okay, then the cause of GDM lies in the hormonal and metabolic changes. Again, this is a bit of a summary repetition. Okay, I am trying to express it in different ways so that this entire thing can happen, can stay in the brain. Okay, so now the hormonal changes in pregnancy, the placenta produces these three hormones we have seen earlier: HPL, estrogen, and cortisol. Okay, and these hormones increase insulin resistance. Why? To ensure more glucose is available for the baby, because the baby requires the maximum nourishment. And that is why these hormones are helpful hormones. They are not bad hormones, but some women, they cause unwanted effects. Okay, so in most women, the pancreas compensates by producing more insulin. So that is what happens to most other women. The pancreas compensates by producing more insulin. But in GDM, this compensation isn't enough. Okay, so what happens? One of the causes of gestational diabetes, you got either insulin resistance or pre-existing metabolic dysfunction. As pregnancy progresses, especially in the second and third trimesters, insulin resistance naturally increases. It happens naturally, understand? If the mother's beta cells can't keep up, then blood sugar rises and then it is called GDM. Okay, so many ladies, the beta cells in the pancreas keep up, especially people who are having regular diet timings and who are not stressed too much, not under tension too much. They have their pancreas beta cells, they normally are able to keep up. Okay, then another cause is pre-existing metabolic dysfunction. Some women already have underlying insulin resistance, either in the form of impaired glucose tolerance or beta cell dysfunction before pregnancy. So they can have any one of these, either underlying insulin resistance or impaired glucose tolerance or beta cell dysfunction before pregnancy. As I said, now it was detected later, but the condition existed. That is why, that is also, it's called overt diabetes mellitus. And then pregnancy just uncovers this issue. It doesn't create it from scratch. Okay. So this we have seen, this risk factors: age over 25, especially greater than 35. So people who are marrying much later, around the age of 35, they have risk factor for GDM. Then overweight or obesity, BMI, body mass index. Body mass index is a way of measuring the weight of the body, and that should, If it is greater than 30, it should, ideally speaking, it should be around 25. But if it is greater than 30, even 20 is good. 20 to 25 is very ideal. If it is greater than 30, then it will be called overweight or obesity. Then if anybody has a personal history of gestational diabetes in a previous pregnancy, this is quite understandable because we told you that the gestational diabetes can remain as a long-term complication. So in a previous pregnancy, the lady had gestational diabetes, then the next child also, she may have GDM, the next delivery. Then previous delivery of an infant with a high birth weight. What is high birth weight? More than 4 kg. Normally 2.5 to 2.8 kg is ideal. Some children may be 3.2, but even that is a bit higher for Indian, especially Indian build. For Western build, it is okay. But any child more than 4 kg, in fact, for India, it will be around 3.5 kg itself will be high birth weight. It again depends from the constitution of the father and the mother. If the father and mother are both overweight, obese, then the child is quite likely to be around 4 kg because it is having a genetic predisposition. Then any lady with a personal history of PCOS, polycystic ovary syndrome, we'll talk about it also. We'll see why polycystic ovary syndrome, what are the problems it causes. Okay, then a parent or sibling with type 2 diabetes. So either parent has type 2 diabetes or sibling. Okay, that another child is having the type 2 diabetes. Okay, then having pre-diabetes, the lady having pre-diabetes, and then it affects dark-skinned women, then fair-skinned ones. So these are all the risk factors. Now let us talk about polycystic ovary syndrome. Okay. Just give me a few seconds. Now here you can see polycystic ovary syndrome illustration. Oh, this is the polycystic ovary. Okay, this is how it is, and this is a normal ovary, and this is a polycystic ovary like this. You can see here, and this is the developing egg. Okay, fine. Now this is the uterus. Now we'll see this in a little bit more detail. Polycystic ovary syndrome, PCOS, is a disorder of chronically abnormal ovarian function and hyperandrogenism. Either this abnormal ovarian function, hyperandrogenism usually involves malish traits in females. Like, some people may have slight hair coming over here, hair coming in unwanted places, all these things. Then irregular or no menstrual periods. Nowadays, a lot of young ladies are suffering. They don't have regular menstrual periods because of so many stress and tension in their life, in their day-to-day work, etc. Or some people, their menses stops very early and it doesn't show any sign of coming back. And for such people, neurotherapy has got wonderful treatments. But this has to be discussed on a case-to-case basis with that person. Find out what are the correct treatments for that person. Okay. So it's not something where it's the same formula can be given to others, to everybody, but we can discuss it in person if necessary. Somebody wants to call, then we can help them. Okay. Then many people who are having acne, that is, small pimples, acne, blackheads, all these things, they all indicate improper removal of toxins from the body for whatever reasons. Oily skin, too much fatty layer, oil on the skin. So these all are some of the reasons for acne. Okay, then obesity and excess hair growth. This is what I said. This excess hair growth is very much related to hyperandrogenism. Then women with PCOS, they do not ovulate. That is the difficulty. PCOS, the ovulation is not proper. And what does it mean? They do not release an egg every month. And they are at a higher risk for high blood pressure. Then they also can have high blood pressure or diabetes, heart disease, and endometrial cancer, otherwise known as cancer of the uterus. So women with PCS, they all have this risk. So many risks. That is why PCOS has to be treated. And PCOS, treating it with non-medical methods is only the correct solution. And one of the treatments is, of course, severe diet restrictions have to be followed. Okay, so that's a different this thing altogether. Then let us now see some facts about gestational diabetes. It usually develops between 24 to 32 weeks and disappears after delivery, but it is possible to develop GDS before or after this time frame. Yeah, as I said, it is not absolutely mandatory 24 to 32 weeks. It can happen anytime before. GDM may go away after the baby is born, but women who have GDM during pregnancy are at greater risk of developing diabetes later in life. So in the mother, it increases the risk of three things. One is called preeclampsia, then another is called high blood pressure during pregnancy and protein in the urine. Now, preeclampsia is what we will be talking about later. Okay. Now, are the causes same as risk factors? Not exactly, but they are closely related. So the causes are not the same as risk factors. They are related. But causes means why GDM happens physiologically. Risk factors means who is more likely to develop it. For an example, the cause is placental hormones cause insulin resistance. That is the cause. Now, risk factor is being overweight increases baseline insulin resistance, making you more vulnerable. So the cause and risk factor are quite closely related. So this also you should try to understand. And in the same thing, we can say as a summary, the causes are hormonal insulin resistance, inadequate B cell response, and underlying metabolic dysfunction. And risk factors are traits or conditions that increase the likelihood of those causes leading to GDM. So risk factors don't directly cause GDM, but they increase your vulnerability to the physiological processes which cause GDM. So risk factors, again and again I say, risk factors don't cause the GDM. The trait was there, but they increase your vulnerability to the physiological processes which cause it. Okay. So now some people may feel this is a very common thing. I've spoken to certain ladies abroad, as part of my patients, this thing, some of them have always felt guilty. They said they thought that gestational diabetes, it's their fault. 100% please be assured, it is not. I repeat, it is not your fault. Absolutely not. It is GDM is caused by pregnancy hormones interfering with insulin function. In everybody's body, something or other, some causative factor will be there. So here, due to some reason or other, which we have seen in the risk factors, etc., and the causes, due to some reason or other, the pregnancy hormones are interfering with insulin function. So you as a person is not responsible for all that. The risk factors like weight or diet can contribute. That is why people who are planning for pregnancy, they should take care of these two things: their diet, eat healthy diet, and then take care of your weight. And for taking care of your weight before pregnancy, exercise, yoga, etc., are the best solutions. Dieting is not a best solution. If you can do yoga, if you can do other things. Okay, so that is why it is not your fault, but it will be nice if you can take care of those who have not are yet not yet conceived, etc., or those who are just in the first month or so. For them, if they take care of their weight and diet, eat sensible diet and eat diet which they can digest easily, not going for cravings of junk food, etc., then if risk factors, these can contribute, but no one chooses their hormones or genetics. You cannot choose your hormone or genetics. So it is not anybody's fault. So it is important to focus on management. That is the most important, not blame. This is due to the hormones released from the placenta. Those who are not diabetic are able to increase insulin production sufficiently enough. Even for a normal person, let us forget about gestational diabetes. Even a normal person, certain people develop diabetes, certain people, many people do not develop. Though, of course, nowadays diabetics are on the high rise, but many of them are because they are not caring for their weight, they are not caring for their diet, so they start. And once it happens, then after that, they feel that depending on medicines is enough, and they don't do other things, or they don't have the time for exercise, etc., because of their busy schedule, etc. Okay, so those who are not diabetics, they are able to increase insulin production sufficiently, but those who cannot increase insulin production enough, or those who cannot use the insulin that is there effectively enough, they are diagnosed with gestational diabetes. So now we come to how gestational diabetes affects babies. If you have gestational diabetes, if the mother has gestational diabetes, then the baby may be at increased risk of excessive birth weight, and that is called macrosomia, large baby. Macrosomia is another word for excessive birth weight. I told you, na, more than 4 kg. For Indians, more than 3.5 kg itself is a large baby. Okay. Depending again on the height and weight of the mother and father. If the father and mother are short, then 3.5 kg is a large baby for that lady. Okay. So increased risk of preterm birth. That means what? Normally birth should happen after the 9th month, isn't it? The 9th month is the delivery period, but in many children, it happens in the 8th month or 7th month end. What happens? Why? Then what is the problem if it happens in 8th month? After all, it's a natural delivery, you may say. Because the baby's lungs, they develop well only after the 8th month. And they require about 1 month, let us say, for the lungs to develop within the mother's body. But now the delivery has taken place in 8th month. So the lungs are not developing properly, have not developed properly. Then body immunity may be compromised. So many problems. Then low blood sugar, hypoglycemia in the baby after birth. That means during birth, the baby had lot of sugar from the mother. The sugar, I told you, the sugar crosses the placenta, insulin does not cross the placenta. That is the difficulty. So before birth, the baby had a lot of sugar, and after birth, it causes low blood sugar, hypoglycemia. For this, we have treatments in neurotherapy. Okay, depending on we have to consider what are the conditions. And an increased risk of respiratory distress in the newborn. We have a treatment called oxygen treatment. It can be given to newborn very simply by the mother itself. Then respiratory distress in the newborn will become reduced. But preferably, these are all after the baby is born. But we would like to see that the mother take proper precautions before the baby is born, so that the baby does not have all these problems. The baby does not have macrosomia or respiratory distress. If diabetes is present in an early pregnancy, there is increased risk of birth defects and miscarriage compared to that of mothers without diabetes. Okay, so these are all how gestational diabetes affect babies? Then still the question happens, how can gestational diabetes affect my baby other than these other things? So what are the other defects? Among the defects in children born to women with diabetes, gastrointestinal tract defects. Gastrointestinal tract defects means difficulty in digesting mother's milk even. Normally, mother's milk is the best milk for children, and up to the age of 2 also they thrive on mother's milk. Okay, breastfeeding is very much a good process, and it is at least till the age of 2, breastfeeding should be continued for the baby, so that the baby develops good immunity and develops good digestive power, etc. So gastrointestinal tract defects, even mother's milk becomes difficult to digest. And then when they go to formula milk, of course it has its own negative points also. Then heart problems, the child can have a hole in the heart. Such heart problems can develop in the children born to women with diabetes. Then oral cleft, here some people you will see that here this place will be cut like this. That is called cleft palate or hare lip. Okay, and this is due to folic acid deficiency. And for such children also, we have got nice treatment where the child benefits. If there is only mild hare lip, then it can join on its own by that folic acid treatment, which can be given to the child. Okay, and if it is given right from the first beginning itself, if the mother knows about this treatment, then the child gets benefited. By the age of 2 or 3, it will have a normal lip without operation, provided they come to us early. Okay, then kidney defects. So oral cleft, that's what is called cleft palate or hare lip. Then kidney defects, then limb deficiencies, brain and spinal defects, etc. Okay, so all these, so many problems because of gestational diabetes in the mother. That is why it has to be addressed, and that is why I thought many people today will be joining to know this problem. Maybe, okay, at least 58 people are here. Okay, doesn't matter. Okay, then now we will see why GDM makes your baby bigger. That's macrosomia. Why it happens. Now here you can see high blood glucose levels in the mother brings extra glucose to the baby. So here we see if your blood sugar level is higher than the standard range, it can cause the fetus to be larger than normal. The excess glucose from the mother acts like extra fuel. So this extra high blood glucose level in the mother, it acts like extra fuel. The baby responds by making more insulin. The insulin does not cross the placental barrier, but the baby makes extra insulin, no doubt. And that is actually, which is a growth hormone. By bringing extra glucose to the body, the baby makes extra insulin, and that acts like a growth hormone. It causes the baby to grow better. But as a result, what happens? This results in excess fat and larger organs. The whole body becomes bigger. That is leading to macrosomia. It causes the baby to put weight. Okay, women with gestational diabetes can face up to 50% increased risk of having a large baby. So you can understand that this gestational diabetes, which is suddenly seen only during pregnancy, though it is not caused by pregnancy, but the baby having a large baby, they are 50% risk is there. Okay, so that is what's written. High blood glucose levels brings extra glucose to the baby, then it causes the baby to put on extra weight due to insulin being produced by the baby. Okay, now here we can see what are the various ways in which gestational diabetes affects women. Number one, it causes reproductive disorders. That is PCOS, etc. They are all reproductive disorders. Then it can some people it can become manifest as breast cancer. And of course, maternal depression is very common. Postpartum blues, it is called. Postpartum blues is very common in gestational diabetes. Okay, then neonatal jaundice. This is for the child. The child becomes has jaundice just after birth, and that at that time it is very difficult for anybody to give. You cannot give many medicines, and medicines don't immediately work, or it can cause various other problems. And for that, for neonatal jaundice, 1-point liver, which many of you will be knowing, I have been speaking about 1-point liver in all my classes. 1-point liver given to the child every hourly, it can help it from neonatal jaundice. 1-point liver into 6. This is a standard treatment, and I have even put videos about this in the group. And anybody wanting this video, you can write, and then we'll locate it for you. Within the group, it is there already. Then ovarian dysfunction. Ovaries start functioning differently. Then type 2 diabetes mellitus, that we have already seen. Gestational diabetes leads to type 2 diabetes mellitus. And hyperglycemia, that is same thing. Type 2 diabetes mellitus is hyperglycemia in pregnancy. Then preeclampsia, high BP. Then macrosomia, the child becoming bigger. And then always, because the child is so big, you cannot have a normal delivery because the passage is too narrow. And so it's always causes cesarean delivery. And cesarean delivery also sometimes has certain unwanted effects. Okay. So now let us see some other facts regarding diabetes, gestational diabetes. Yeah, now the number of people a little bit more, few more people have joined. Okay. Welcome to all of you who have joined recently. Now, wait a minute. Why is this annotation? I have disabled annotation for others. Okay, fine. Okay. So this cannot be. So whoever who has by mistake, they have touched their mobile, they have caused this thing to happen. So, madam, if you can erase it, please try. Somebody can try to erase it. Whosoever this has come, because it will come in every of my slide now. I am not able to erase it myself. Okay. Right. Fine. Thank you. Okay, now what are the warning signs of gestational diabetes? We should know how, so is there any warning sign? Unfortunately, first sentence is GDM typically does not cause any notable signs or symptoms. So any noticeable signs or symptoms are not exhibited during GDM. But you can have sugar in the urine, unusual thirst, then vaginal, bladder, and skin infections, frequent urination, fatigue. Fatigue during pregnancy can be due to many reasons. One of them can be gestational diabetes. And then nausea, blurred vision. So these are all some of the warning signs of gestational diabetes. Okay. Then other signs and symptoms. This we have seen increased thirst, that is called polydipsia. This may be accompanied by other signs of dehydration, such as, see, normally when increased thirst is there, you should have increased urine output. But here in gestational diabetes, for certain people, it causes decreased urine output, then reduced sweating and tear production. They are sorrowful, but tears don't come from their eyes. Then muscle cramps. This is often due to calcium or sodium imbalance. And for muscle cramps, we have got a nice treatment called 125 DCC. It's a very nice treatment. Okay. Then weakness, fatigue, then lightheadedness, something feeling like dizzy or lightheadedness and nausea. And liver failure may also be a cause of thirst. And in fact, for liver, that is why we always say for just GDM or otherwise, all pregnant ladies, they should take liver treatment. They can take, anybody can take liver treatment. It has got absolutely no side effects. Anybody can take liver treatment as often as they can. 4 to 6 times a day is very ideal. Okay. Then increased urinary frequency, decreased urine output, but increased urinary frequency. That means you go and only pass a little amount of urine. Then yeast infection, that is called Candida albicans. Candida is a fungus caused by a yeast that normally lives on the skin and inside the body in places such as the mouth, throat, gut, and vagina without causing any problems. So it does not really cause problems, but there will be some itching, etc. UTI may be there, vaginal thrush may be there, like that. Okay. Then GDM, this, as I said, does not cause noticeable signs or symptoms, but you can have nausea. We'll talk about it in the next slide. Then it can be blurred vision, then excessive hunger, then fatigue. The causes of fatigue include anemia, diabetes, thyroid disease, heart disease, COPD, obstructive pulmonary disease. Okay, then sleep disorders. Okay, so all these things can happen. Then nausea and vomiting are symptoms of a disease or condition, such as gastroenteritis, it's also known as stomach flu. Then food poisoning. Food poisoning, when it happens, that is why normally pregnant ladies at that time should not eat any outside food, because food poisoning normally happens from food which you cannot digest, which does not agree with you. If it is food prepared in the house, it won't have that problem. But food prepared from outside, chatpata khana we say, so that sometimes it causes, it can cause food poisoning. And that pregnancy, of course, is one of the most important symptom, distinct cause for nausea and vomiting, then acute gastritis and pancreatitis. Once the person can keep fluids down, they should start eating a brat diet: bananas, rice, applesauce, and toast. This is the recommendation by internet. We can have our local things instead of rice. People who cannot eat rice, people who cannot eat gluten, also wheat, then they can substitute by millets. That will be really very good. Okay. Then appendicitis, brain tumors, etc. These are all other signs and symptoms. This then GERD is a very common problem for ladies with during gestational diabetes. Okay. Esophageal reflux disease, it's called GERD, gastroesophageal reflux disease. Okay, then how do you control GDM in the third trimester? So we are now coming almost to the end of today's lecture. Gestational diabetes can be treated with dietary changes, such as decreasing your carbohydrate intake and increasing fruits and veggies. This is, in fact, really common sense. Diabetes, they always say, increase fruits and veggies. Once you are eating your less carbohydrate from rice and wheat, etc., any amount of fruit, whatever you eat, that will not harm you, because fruit is always a good substitute to give you slow release energy. The body requires carbohydrate, but processed foods and certain people gluten, etc., they cause increased blood sugar. So for them, if they avoid those things, then millets is a very good source of carbohydrates, controlled carbohydrate, this thing, and then fruits and veggies. Veggies have a lot of natural salts also. So if you steam cook it with least amount of salt, then you won't even have high blood pressure. So that is these are all some of the things which you should know. Then lifestyle changes such as adding low impact exercises, yoga, meditation, etc. And lastly, medications in uncontrolled GDM. Uncontrolled GDM medications are needed, of course. Okay. Now, a very, very interesting question. Can GDM be prevented? Very certainly, yes, it can be controlled and prevented, provided you start before itself. So go into pregnancy at a healthy weight. That means if you are having overweight before pregnancy, then reduce your weight, do all things possible to increase exercise, etc., modifying the diet, etc. All those things you have to do, doing yoga before pregnancy. The yoga done before pregnancy is very good. In fact, there are certain yogas which can be done even during pregnancy, and they keep your body fit. So go into pregnancy at a healthy weight. Then measuring out smaller portion sizes. That means we don't ask you to starve. You take small portion sizes, and that the body can digest easily, and then avoid packaged food and junk food. Now, this does not require any explanation. Packaged food and junk food are always harmful for the body, for anybody. Nowadays, so many children are eating packaged food and junk food, and some of them are surviving solely on these things. Executives are surviving only on packaged food and junk food. So all those things are a problem. Okay. Then limit added sugars. Added sugars and processed foods, they invariably come only in packaged items. So many types of syrups, corn syrup, etc., are added to make the taste sweeter, so that people get addicted to it. So like that, you can see in this thing, corn syrup, etc., is added in many processed items, especially those which taste a little bit sweet. They have that added corn sugar, and they are very high sources of carbohydrates. Okay. Then replace candy with fruit. You want to eat some sweets, have a sweet fruit. Whatever sweet fruit you want, you can have it, provided you are limiting added sugars in processed foods. Okay. Eating more for people who are non-vegetarians, eating more lean protein such as fish and tofu, they stay fuller for longer time. That means you feel full after eating these things, tofu or fish. Okay. Then increasing fiber intake by eating plenty of vegetables and whole grains. Yes, these whole grains are very useful, and in fact, some dietitians even used to recommend that in case you have to eat, you want to eat wheat, gluten does not cause you a problem, let us say, or wheat or anything, even millets, etc. They say you now ferment it. Sorry, what you call ankurit karna. Sprout it, make it into sprouts. You put it in water, soak it overnight, then remove it, then tie it in a cloth, then it will become small sprouts. Whatever be it, then use that sprout for making your atta, for millets, for anything. The wheat also can be sprouted very well. So if you want to eat wheat, have sprouts. It will not cause you this gluten intolerance also. Many people, if they start sprouting their wheat, they will not have gluten intolerance, because it becomes high value protein. Okay, and that is whole grains. Whole moong sprouts are very good as a source of vitamin B12. Methylcobalamin, natural methylcobalamin is in whole moong, sprouted whole moong. Okay, then replacing juices, dairy laden coffee drinks and sodas. Nowadays everywhere you see this, you press the button and you get coffee. That is all dairy laden coffee drink. That is all juices contain invariably a lot of processed sugar is there added. Whenever you feel you are eating juice, understand that juice is laced with, because they have to sell, and if the fruit is sour, then people won't take it, so they will add extra sugar, and they add loads of sugar. because they are not going to get diabetes. It's you who are going to get diabetes. So juices should be avoided. Instead, you choose that fruit, whatever fruit, instead of having it as a mosami. Mosami is a very common juice. Mosami juice or pineapple juice, or apple juice. So all these things, they add sugar. So preferably you should avoid. This is for everybody, not only for gestational diabetes. Okay, replacing juices and dairy laden coffee drinks and sodas with herbal tea, black coffee. Yeah, you can have black coffee if you want one now and then, occasionally. Too much coffee is also this thing, not good, but little bit you can have. Instead of dairy laden coffee, you can have black coffee or sparkling water with lemon or lime zest. This is the best. This is the best. Normal good water with lemon or lime zest. Then exercise helps to the body to become more sensitive to insulin, which helps regulate blood sugar levels. Even walking 30 minutes a day helps. For people, I tell those people for whom 30 minutes a day walking is not possible, I say you at least, if you are having a 10 steps staircase in your house or near your house, you can just climb 10 steps about 20 times. It will become 200 steps. It may not be taking 30 minutes, but that is very effective an exercise for keeping yourself free from diabetes. And then we have got in a Japanese exercise called Jin Ji Du Li. I will write this in the chat just for maybe you have heard about it. Maybe I have spoken earlier. I keep speaking about it in many groups. Jin Ji Du Li. Now, this is a very exotic name. Okay, everybody, I have written it in the chat. Jin Ji Du Li. What is it? Standing on one foot. Standing on one foot is not like doing Rikshasana and all that. All that you have to do, keep it for, especially for people who are afraid. If you are more than 35, you don't do it. You do it this way. What you do, keep a chair in front of you. Just slightly hold the chair, not too much pressure. Just slightly hold the chair, and then lift one foot about 3 to 6 inches above the ground. You don't have to lift it very high. Just 3 to 6 inches above the ground, you have to lift. That's all. Stand, say, for 15 seconds, 20 seconds. Keep a stopwatch in front of you. I mean, to do it in front of this thing, you keep your chair facing a clock. Say 15 seconds you do. Then change the leg, go to the other leg. Then do 15 seconds. Like that, you can do up to 2 minutes, 5 minutes. Any amount of time you can do it. It's absolutely harmless. It has got no side effects, but it has got a lot of benefits. It reduces BP, it reduces sugar, because you are working on the calf muscles. Anything you do for your calf muscles is going to help your diabetes, is going to help your body weight. Anything you do with the calf muscles, just keeping the calf muscles like this, I'll show you. Just lifting it like this. This itself is enough. I will show it later. I will show it when in full screen. Now the screen is limited. I will show it in full screen later. It's a very simple exercise. Very simple but very effective exercise. Okay. So then we'll continue this. Manage existing medical conditions like PCOS or pre-diabetes. Then they have to be managed. So all these things can be done to prevent gestational diabetes from happening. Okay. Now, I think we'll come to the last slide now. So this much we have done in today's class. So in our next class, what are we going to cover? We are going to cover diagnosis of GDM, then management and treatment, both through medical methods, what are the standard procedures, and what we can do with neurotherapy. Okay, then complications for both mother and child. What are the complications they will face? Some complications I have told you now, some more I will see if anything is left out, we will cover it in the next class. And then postpartum consideration. So, and then we are going to cover these following FAQs first. What are the normal glucose targets during pregnancy? Will GDM go away after delivery? Is insulin safe during pregnancy? Do I need a cesarean section if I have GDM? Okay. Will my baby get diabetes? Can GDM harm my baby? So all these questions will be answered in the next class. Okay. So with this, I am now going to now if there is any questions which are not in this group, if you have questions and if I think I can answer it, I will answer it. Otherwise, we will have any other question answer session what you can have. Okay. So now with this, I stop share and okay. Now I will show you what I said. I will show. So like this, keeping your leg like this. Okay. So keep it. You can do this sitting on a bed and dropping your foot down. So just do like this. That's all. Lift it 20 times, 100 times, 200 times, like that. You can do it with. You should do it with both feet. Either you can do both feet together. You can do both feet together like this, or you can do one after the other. Okay. And another thing, even this helps. Even this helps. So these are all things which you can do easily. Sitting while you're watching TV, you can do this. Do this, do this. But more than that, this calf muscle is going to help better. Okay. So this is it. I hope you have all enjoyed today's session. Now we will go for 1 minute. I'll just check this.
I request everyone to raise your hands only with the session 1 doubts. So whichever has been done so far, you are welcome to ask doubts on that only. Okay. And please switch on your videos when you are raising your hands because it's very important.
Yes, Sister Mercy Angelina has raised her hand. Yes. Good evening, sister. Yeah, I can't hear you. You can switch on your this thing. Are you able to hear me?
Yes. Yeah, I'm hearing, sir. Yes. Good evening, sir. Good evening. Good evening to all. Yeah. Sir, during first trimester, pregnancy ladies are vomiting, no, sir?
Yeah.
So that time we can give liver?
Yeah. Liver, and we have got other treatments. I will discuss this in the next class. What are the other treatments? I mean, even now you can, you know our formula, CNNS gas, all three sides. CNNS gas. I will show it to everybody. Now I will now switch you off and then I will show CNNS gas. This is already known, but still I think any other question for you?
Only that much, sir.
Okay,
only
fine.
For pregnancy.
Yeah. So very simple. Everybody can do this. Just they will sit like this. Here you place this thing pillow over here. Now today I have using a different camera for a different purpose. I don't have that long camera, but you see. Okay, this like this. Here you are going to keep a pillow over here, and then all that they have to do is just catch. I will show with one foot. They have to do it with both feet. Let us see. I will see if I can. Yeah, this is okay. Yeah. So they have to keep like that and then slowly do this. Okay, like this. This has been covered in our earlier diabetes class also. So like this, 3 to 9 times. Let them do this. Before every meal, they can do it. And even when they are feeling vomiting, they can do this. Okay, because this is a digestive issue. So if those people do that between 3 to 9 times, if they do this and do it every 3 hours, whenever they feel uncomfortable, because this is related to the stomach, and this particular thing, that exercise, it stimulates the Vajranadi. The Vajranadi is working.
Sir, excuse me. Before meals, they can do this.
Yeah. Before meals. Before meals is ideal. Even they can do immediately after meals also sometimes, because you see, sometimes ladies get after eating a little bit, they feel nauseous. Then they can do this immediately, and they do this and then do the liver also. So you have got 2 treatments. One is this CNNS gas.
CNS gas, and this is
liver. No, this is called CNS gas.
That's what I'm telling you. This is CNS gas plus liver.
Yeah, plus liver.
Okay, sir. Thank you so much, sir.
Welcome. My pleasure. Okay. Anybody else? Any other person has raised their hand? If not, also you can call it a day. Doesn't matter. Yeah, nobody seems to raise their hand, so it's okay. Today it was a theory session, so I don't think there are any doubts, much doubts. I think I have covered everything quite reasonably okay, and I was not very fast. I hope the speed was okay. So anyway, thanks a lot. Okay, madam, it is now a 9:15. We can, since nobody else has raised their hands, I think we can call it a day.
Someone just raised a hand. Was
okay,
it
they did.
Asha and Riker? Was it you?
Who raised the hand?
Asha, I guess, but they again put their hand down. You can raise your hands once again. If anyone has doubts, please raise your hands because we don't know who was that person who raised hands. So if no doubts?
No, it looks like that it was a mistake perhaps.
Okay, fine. So there are some messages in the chat box.
Oh, I'll see that. No, there are only two messages. One is somebody has written Pranam Acharyaji, and one is my message, Jinji Duli.
Okay, I can see Garudasan and Vrikshasan.
Where is it? I am not able to see.
I think it is directed to me. Next, how to do lever. It was question.
Okay, very good. How to do lever, I can show you right now.
Yeah.
Okay, that's right. Just hold on. I will make this image a bit more bigger. Okay. Now, lever is a very useful this thing. It is done only on the left hand. Sorry. It is done only on the left thigh and the left hand. And it is to be done simultaneously on both. It is to be done simultaneously. I have to apply simultaneous pressure over in 3 places. 1, 2, 3. I have to apply pressure on the left hand and also simultaneously 1, 2, 3. So this is the principle. Fine. So what you have to do is then that's it. So what we normally do is we keep our hand like this, and with the pressure, if another person is there to give, then we can put our hand on a pillow here, and then we can lie down like this, and then that person will apply pressure simultaneously here and here. Press for 6 seconds, then here and here, press for 6 seconds, then here and here, press for 6 seconds. And in between, there will be 1 minute gap. But now I am teaching you how you can do it on your own, how the lady can do on her own. Okay, on her own, how she will do. Now I am using this portion of my hand. I am going to press like this with the palm, like this. And here, this bone, this will press over here like this. And I will lean forward a little bit. Okay, I lean forward a little bit. So I keep like this, and then I keep my palm like this, and then I lean forward and say 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Now this pressure should be applied continuously. It should not be like this, No, understand? So we apply pressure like that. Then after that, you wait for 1 minute or at least 30 seconds. 30 seconds you have to wait. It will be ideal. Then after that, after doing here 30 seconds, you are waiting. Then you are going to second location. So second location is where this was first location. Second location is middle. And then again here also middle. And then you always have to pull inwards like this. You should not do outside like that. So when you are giving the pressure, you have to pull inwards, slightly inwards. And then 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then wait for about 30 seconds. 30 seconds minimum. 1 minute is ideal. And you may say, why we have to wait for 1 minute? It is like, you are giving a servant some job. Then you give him some time to finish the job, then you give him the next job. Now, by doing all this, I am stimulating different parts of my liver. My liver is in the right side over here. I am stimulating different parts, and they will do different jobs. That is the purpose. Now, the third one, 1, 2, you have done third one here, and then you are now going to keep it here. Okay. So third one here. First one was here, second one was here, third one is here. And then again pull inwards. Then 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Then again wait for a minute. Then fourth place, same as first place. After waiting for 1 minute, you go to the first place again here and here. 5, 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Then wait for 1 minute. Then go to the middle point. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Then again wait for 1 minute. This waiting for 1 minute is very essential. That is what many people don't follow. They just say, okay, we'll do it all together. All together will have some effect, but it won't have such a nice effect as the waiting. Now here, last one, 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Yes, that's all. With this, we have completed the liver treatment. Do this at least every 2 to 3 hours. You can do it before food. You can do it after food. You can do it after getting up from this bed. You can do it as many times as possible in a day. And then it has got wonderful results. In another class.
Query here. I have a query here.
Yeah.
In the first point, especially when pregnant women, their bellies would be, troubling during, pressing the number 1 point. So how would they go about it?
In the first trimester, their belly won't be pressing so much. And for pregnant women, I normally request either the mother or the husband or the grandmother, they should lie on their back and somebody can afford pressure, or they can sit on a chair and then keep one hand. If they have a chair with some support, they can keep one hand on that chair, and with a pillow, somebody can press for them. Pregnant women, I normally say, for pregnant women, the better treatment will be on the leg. We have got a treatment in the leg also. That also I will show you. It's a very good, lovely question. Thank you for this. Yeah. So pregnant women, now this is only the left leg. My left leg, big thumb, then 2, 3, 4. The fourth finger is, according to neurotherapy, the liver finger. Okay. So according to neurotherapy, we say this is the liver finger. So we have to only do like this, like this. Okay. 20 times in 3 locations. So how do we do? 3 or 4, we will see. Okay. One is like this, catch hold of it, catch hold, one here, and then the other one here. Okay. And I catch hold like this. Okay. Then just slightly twist. 1, 2, 3. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. I'm just twisted lightly here, the skin. I am not twisting the finger like this. See, I am not doing this. All of you understand, I am not doing like this. I am only twisting the skin. This is where the nerve plexus are all coming. Over here, the nerve plexus come. So that is where I am twisting. Okay. Then the other one will be, put my finger in between like this. Then same way you do. 1, 2, 3, 4. See, I am not twisting like this. Understand? I am not doing this. I am only twisting the skin. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now, normally this and this is enough. If somebody has pain, they can feel here. Then this joint also they can do. Same way. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Then here, like this, 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Plus, if they do this, every hourly, every 2 hourly, then this also for them is enough for liver. Either they can do this way or they can do this way. They can do, if they cannot do 20 times, let them do 6 times, 10 times. Something they will do to stimulate the liver. Okay. Thank you for this question. Very wonderful question.
Thank you, sir. I just got a doubt, so I just...
No, wonderful, wonderful. You see the doubt you have voiced. Maybe many people may be having. See, unfortunately, I don't know whether anybody here is actually a person who is having who is pregnant lady is attending or not. We don't know. If they were there, they can ask their own practical questions and we can answer. Please, all of you, those 60 people who have joined today, please tell your friends, relatives, at least next class, let those ladies who want this class, I mean, for whom this class will be beneficial, let them join in great numbers and we can give them practical training. So it will be hands-on practical training like I'm showing you now. You can all do it and you can follow it very nicely. And they have to attend the live class. There is no point in asking, please give us the recording. Is first of all, free classes. Recordings are normally not given. And they are not there. The feeling you get in attending a live class and asking questions, that does not come in just going for recording. Okay. So I hope nobody. Achha, somebody else had one hand and then that hand went away. Doesn't matter. Don't remember. Okay. Then shall I finish it off?
Yes.
Oh, yeah. This lady, Premlata Modani ji is having, her hand is up. Yeah, please.
Please.
Please, madam.
Unmute, sir.
Yeah, please unmute.
Sir, please show us all the organs on the fingers in neurotherapy.
All the organs in the fingers. Very good. In neurotherapy, we have got this is the left leg and this is the right leg. Okay. Both these we call, I will show one by one. You just want to know the name because the treatment is the same. Okay. The treatment is only like this. Now I will show you the name. This is called gas from the stomach. Okay. This is called gas from the stomach. Treatment is the same. So that treatment I am not showing. This is called gas from the stomach. Then this is called pancreas. Okay. This is the head of the pancreas. Then this is the third finger is the liver, gall point. Then fourth is liver. And fifth is right ovary. Okay. So gas, pan, head of the pancreas. Then this is the gall. This is the liver. And this is the right ovary. Now, if you come to the left leg, I mean to the right leg, this was the left leg. Gall and liver are on the left leg. Now, if you come on the right leg, this is the gas from the intestine. So that means anybody who is having flatus passing gas from below, for them, this treatment helps. Okay. Then this is the tail of the pancreas. This has got different uses according to the situation. Okay, but it is basically pancreas. Okay, then this is the spleen. This is what we call as the mucus. And this is the left ovary. So spleen, mucus, left ovary. In fact, for people who are having constipation, severe constipation, if they keep on doing these 3 fingers repeatedly, 5 times, 6 times, 6 rounds, whatever, and every time the same way you have to do only like this and like this. Okay, the technique is the same, what I have shown already. But these 3 fingers together, they help the right leg, 3 fingers, they help in constipation. And similarly, for loose motions, these 3 fingers on the left leg, they help in loose motion. That means they help to control loose motion. So left leg, loose motion, right leg, constipation. Okay. Very lovely question, very practical question you have asked. Thank you very much.
Thank you, sir. You have explained very nicely. And
Thank
sir, next question is that you have told me that do 20 medulla, then 10 medulla, and then 5 medulla. Then all has to be done at one time, or once I have to do 20, then in afternoon 10, or then 5?
No. For what purpose did I tell you? These medullas do a lot of job. What purpose did I tell you?
For I have very less weight.
No. Then it is not 20 medulla, 10 medulla. It must be the medulla must be 10 medulla, 6 medulla. No, 15, 10, 6. This is
15,
what we say. You
means
please see.
all three has to be done together.
With 1 minute gap. Yeah, not one in the morning, one in the evening, one at night. No, not that way. It is a package. It is a package, and in between you have to wait for 1 minute. When I give 15 medulla, first you have to wait. You do 15 medulla on both sides, then wait for a minute. Then give 10 medulla. Then wait for a minute. Then give 6 medulla. Wait for a minute. These three together will help you in improving your body weight. But maybe you also, if you have time, sometime you come for a discussion. We will see what other things we can help you. Okay.
Means on WhatsApp or this one Telegram?
No, on Zoom. It will be a personal chat on Zoom. You write to me. I will see. I am a bit busy now, but still we can help definitely. For people who are so interested in getting my help, I will definitely help.
Really, I will write, sir.
Sure. Yeah.
I will try this one for whenever constipation is there, or
yeah,
because so many times I have a gas problem. After eating one chapati, I feel gaseous.
Oh, then you should do this CNNS gas on these both toes. You do it, and then do liver, and then eat. Of course, that 15, 10, 6 is also ideal for all these things. Because everything is because you are not able to digest food properly. So you are not getting that feeling for eating sufficiently. So once you start digesting these 15, 10, 6, they will help you for digestion. And also all my toe finger, then all these things, this the CNNS gas, I mean, all these things, everything together for you will require. And in between each, you have to give 1 minute gap. That 1 minute gap is needed.
I will do that. Then 15 after 15 days, result will be there then?
Yeah.
Yes, sir.
What is your weight now?
My weight is 36 kg.
Oh, no. It has to improve. Then are you doing Surya Namaskar or something like that?
Sir, my left leg is little weak. So I do physiotherapy exercise, and now I have joined swimming also.
Wonderful. Swimming, but swimming, swimming may even reduce the weight, because you see, whatever excess fat, etc., that also contributes to weight, no? So that excess fat sometimes will go in swimming. It's not bad. I am not saying don't stop swimming. What you should do before, you should take proper nutritious food like sprouts. After swimming, you should have sprouts, either sprouted chana, sprouted moong, something like that you should have. And avoid all gaseous items like potato, etc., whatever. Potato, for everybody, please understand one thing. Yeah, 60 people are there. Very good. Potato with skin, when it is cooked with skin, properly washing the skin, you cook it with skin, it will reduce gas. Potato eaten without skin will increase gas.
Okay,
please
then
understand
I will
this.
cook with
and another thing, that skin contains something to help the thyroid hormone. It is a slightly greenish color will be there, slightly greenish color. That is, I believe, that has got something to do with iodine, natural iodine. So potato with skin is beneficial for the body. Potato without skin is not so beneficial. It may aggravate the gas situation. Not everybody, of course. Some people may be able to eat it. But I have seen in general potato with skin, and it tastes better also. It depends on how you cook it. It tastes better with skin than without skin. So try it out. All of you can try it out.
Yes, I will try it with skin, because with skin it is not tasty.
I know. Without No, with skin or without skin?
With skin, it is not tasty, no?
No. Then that means, yeah, but it will help your health.
Now I will start preparing with skin.
You see your health, no? Just eat it and see whether your gas is reducing, whether your even body weight will start putting up if you eat it with skin. Of course, it may take 1 month or so. Doesn't matter. You will not. It will not harm you. I have seen its effect. I will
do sure.
And anything else by the way of hint? Even coconut, when it is taken with that coconut milk, you take a full coconut and heat it in the gas, and then later on you can it will all become like a pulp. That is also very good for improving body weight. It's a whole nourishing this thing. Of course, there are some people may say it may increase cholesterol, etc. But for you, cholesterol is not a problem. For you require a little bit cholesterol, so it's all right. You try it out. See if you find it tasty. You can either have it with either the cooked coconut, or you can try one day without cooked coconut. Eat everything together. Mix the water, the flesh, everything. You put it in a mixie, and then make this thing and eat it. It's all. Coconut is anyway a very good diet. It's very good for diet. It is carbohydrate, protein, fat, all three are there in coconut, isn't it? Okay, now it is now 9:35. If anybody else any other question, it's all right. Otherwise, we can call it a good night. Okay, right now. Okay, then Anusha madam, shall I give my blessings?
Yes, sir. Please go ahead.
Okay. Thank you, everybody. Thank you, Joshi sir and Joshi's Kerala group and Anusha madam. And with my whole heart, I pray to God that may all of us always be full of health, happiness, harmony, peace, prosperity, and success. May God's choicest blessings be on us and make us always full of health, happiness, harmony, peace, prosperity, and success. Thank you very much and good night.
Thank you so much, sir. Now I'm not giving chance to raise your hands or ask doubts. Now I would request all of you to go back to the group immediately and share your vote of thanks, because I'm not opening your mute voice buttons now. Okay. And those who have query, please go back to the group and say at Neurotherapy, Ramachandran sir, please clear this query and write your query so that your query is cleared. So from all of us, we end this session with lots of love, gratitude to Ramachandran sir for this wonderful session. And again, we'll be meeting on next Friday for the second session. Please don't forget and join on time. And tomorrow, please join your 7:30 acupaper therapy session. With that, I end this session. Thank you, sir. Good night, sir.
Thank you, Geeta Gupta, madam. Thank you very much.
See you again next Friday, sir. Thank you so much.
Yeah.
So please, all of you, I request you to go back to the group and share your vote of thanks. Thank you so much. And your queries also. Please don't forget. So meet you again tomorrow, 7:30 p.m. Till then, good night. Happy weekend to all of you. Thank you, sir. Bye, sir.
Bye.